Okay, so my name is Jennifer Higginbotham, and for my capstone presentation for my BSN program, I chose compassion fatigue, to do awareness and education for compassion fatigue for oncology nurses, preferably in the outpatient setting. So my objectives and goals were to determine the best practices for oncology nurses as far as education goes, and to identify any current practice gaps, whether they're using education or not, and to make any recommendations moving forward. So what is compassion fatigue? We all have it, right? So emotional and physical exhaustion that can lead to a decrease in empathy for patients. Can you guys see everything?
Mm-hmm.
Okay. But some people state it as a secondary form of post-traumatic stress syndrome, which is kind of interesting. And it's not the same as burnout. Physical burnout can be from working in an understaffed facility, can be from working long hours, can be from working many days in a row without taking a day off. Compassion fatigue is not the same thing. Compassion fatigue is usually from working with somebody who is chronically ill, having many patients die on your watch, and you can kind of feel a little more where you've given of yourself a little more to these patients, and they die, and you just kind of feel at a loss. So, the introduction to my problem. It's the cost of caring, which is, all nurses can relate to this. But 74% of nurses relate being concerned about their work-related stress. That number seems probably low when you look at the amount of nursing that is given in any day setting. And considering that 90% of RNs are women, and why is that important? Because women are at a higher risk of developing compassion fatigue. And so 55% of RNs state that they work more than 40 hours in any given week. You know that too.
Imagine that.
Okay, so some signs and symptoms of compassion fatigue can be loss of empathy for your patients. Sometimes you can kind of lose that sense of wanting to give more care than you should because of getting too attached. Irritability, dreading coming to work. Some days we have those, right? Trouble sleeping.
Every day.
Impaired decision making and diminished job satisfaction. Just to name a few. Some risk factors. Caring for chronically ill patients, having numerous deaths on your watch. And an inability to shut off. And what that means is, and as a nurse, and we all know this to be true, anytime we are out in public, have you ever just kind of like, you saw a guy or a patient or somebody walk by and he has like a strange lesion and you're just immediately like, ooh, what do you got going on?
You should have that looked at.
Yeah, you should have that looked at, exactly. Or, you know, you see an accident and you see someone fall and you immediately rush over to them. That's because we don't know how to shut off what we do every day. And oncology nursing is no different when it comes to caring for our patients. We can become really overly involved and give more of ourselves to our patients than we probably should be. And we're more concerned with doing our job well that we kind of lose sight of how to balance taking care of ourselves versus taking care of just our patients.
Been there, done that.
Been there, done that. So for my PICO question, for oncology nursing, does education and coping strategies and awareness of compassion fatigue compared to no education decrease compassion fatigue when measured over a 6-month period? So for my literature review, I use the electronic database CINAHL, EBSCO, and OVID, and I use my keywords as compassion fatigue, oncology, nursing, and education. Within 5 years, I used the search, full text articles, and peer-reviewed journals. My first article was a perceived quality of work life and risk for compassion fatigue. This was a study that they chose 50 oncology nursing nurses to do questionnaires to determine whether they were able to strategize as to work-life balance and what they perceived as knowing what their strategy was as far as when to become overly tired and when to take time off, and if they knew how to work-life balance. My second article was the effects of a provider resilience mobile application. So using a mobile app on your phone that told you when you needed time off and when you had been working too long and when was the last time you took a break even while you were on your everyday duty. So
More
this
than
was
5
an
minutes in the
interesting
bathroom.
article. So the conclusion from my literature review is that oncology nurses are at a greater risk for compassion fatigue, as well as ICU nurses and emergency room nurses as well. So, and according to this Pro Quality of Life test, oncology nurses were at the greatest risk of developing compassion fatigue. And most facilities take a reactive approach rather than a proactive approach when it comes to how nurses are dealt with whenever we're experiencing this. Most of the time they just say, oh, you're just having a bad day and maybe you need to take some time off, when sometimes we
Need some real time
need
off.
some real time off, or maybe we need some extended time off. So that also too. And it's always harder when you lose a lot of patients, and I know that you yourself too, you get a little overly involved. And there's this old saying that it's like an Indian proverb where it says that every time you care for a patient, you give a little bit of yourself until one day there's nothing left.
Yep.
And there's nothing left to give of yourself. So after being educated, nurses reported having a higher job satisfaction just because they knew what to look for. So any practice gaps, right now there is really no current education that's given to nurses, especially in an onboarding or in an orientation setting. But it could help staff acquire and interpret and use education for health promotions. So my recommendations are to set professional boundaries when it comes to dealing with your patients. Sometimes that's harder for us because we want to go above and beyond for our patients, but we do have to learn how to set professional boundaries. Promote self-caring, and what that means is if you have time off, take time off. If you need a vacation, take vacation. Allow time for reflection at work. So if you had a bad experience, there should be time where you can come and sit and talk to other people that have maybe had a similar experience. And also identify any milestones that so praise your nurses, make it a good experience while they're at work, and assist any new nurses that are coming on board, because sometimes pairing them with an older nurse can give them a sense of a mentor and someone they can go to whenever they're having this. So here's my references, and thank you so much.